All right, we will go ahead and get started. I'd like to welcome everyone to our bi-monthly community conversations webinar. These sessions are really meant to engage with you, share information, hear from you about your questions, experiences, and to truly have a conversation with you toward the end of the session. Today's community conversation is a guide to ORH data resources for your rural health grants and research. And before we get started, I wanted to go over a couple of logistics. The audio has been muted for all attendees as they come in. And you can select the ellipses on the right of your screen to populate the chat feature, which you can use to enter your questions in as we go along. We're going to monitor those questions and ask them of Emerson at the end of his presentation. If you'd rather, you can raise your hand and by clicking on the hand button at the bottom of the screen, and we'll ask you to unmute so that you can ask your question live. And lastly, the presentation slides and recordings will be posted shortly after this session within the next day or so at a link that I'll put in the chat in just a moment. And with that, I am really pleased to introduce Emerson. Emerson Ong joined our office, the Oregon Office of Rural Health, in 2000 after learning about access databases and survey tools at the Department of Nursing Administration at Johns Hopkins Hospital. At ORH, he has expanded and consolidated demographic, health status, and health utilization data and established ORH as a statewide resource for rural Oregon zip code level health data. Emerson utilizes GIS to present this data in graphical maps of the state. Data reports and maps are available on our website. I'll put a link to our data link in the chat in just a moment. But you can also contact Emerson for customized data or maps to inform facility operations, community health improvement planning, as you write grants, and all of those sorts of things. So with that, I am pleased to give the floor to you, Emerson. Go ahead and take it away.
Hi. Before I start, actually, there's a button on the top right side of all your screens called Layout, I believe. And then if you click on that and choose side by side, it will put everyone's faces on the right side of your screen and then expand the presentation itself. So it'll have more vertical space, which is really important because I'm going to show a lot of maps today, and it'll show up better on your screen. So for those of you who don't know, my name is Emerson Ong. I'm the Data and GIS Analyst for the Oregon Office of Rural Health. Today, I'm going to go through three parts. The first part is the 2023 Areas of Unmet Healthcare Need report, then the 6-page primary care service area profiles, and then I'll give you a tour of all the data elements in our website. So the first part, the 2023 Areas of Unmet Healthcare Need report, is a report that we've done every single year that compares all 128 primary care service areas in the state of Oregon according to 9 different primary care, dental care, and mental health care variables. So your first question should be, what are these primary care service areas? So as you know, there are 36 counties in the state of Oregon. And one of the beautiful things about the state of Oregon is that it fits perfectly on a 9.5 by 11 sheet of paper. As you can see, a lot of the counties are really large lane counties, over 100 miles wide, which is wider than the state of New Jersey, which is where I'm from. And there's a lot of data that comes at the county level, and that makes sense for about the eastern 2/3 of the country, where the counties are small and they're all like pretty much the same size and shape. But for the western part, the counties are really large, and so if you present county level data to a place like Florence, Oregon, for example, that data is not going to be relevant to them really because Eugene is also in that county. And so that data is going to be skewed by Eugene. And so we wanted to be able to present the rural communities we serve with relevant data for their community. And in order to do that, we wanted to break the state down into smaller geographic elements. So we decided to use zip codes as the basis for these smaller areas. Um, and why did we choose zip codes? Like, how many people here know what their census tract is? Unless you're a total nerd like me, you probably don't know what your census tract is. Um, I actually don't know what my census tract is either. But uh, there's a ton of data that goes along with zip codes. There's a lot of demographic data, lots of healthcare data. And so there's about 470 or so zip codes. We decided to group those together into geographically contiguous units that follow main roads, have at least 800 to 1,000 people or more, which is a number able to theoretically support a mid-level provider, and have a rational medical trade or market area and are congruent with existing tax and hospital districts. So we ended up with 128 service areas out of 470 zip codes, 86 of which are rural, 18 are frontier, and 24 are urban. And so this is a map of uh, zip codes, and then we broke that down to 128 primary care service areas. And again, this is what the county map looks like. So this is a map of uh, our definition, our office's definition of rural. Rural is any place that is 10 or more miles from a centroid of 40,000 or more. So on this map, the buffers in yellow are urban, and then the counties that are in darker green are frontier. Frontier is a county that has 6 or fewer people per square mile, and then everything else is rural. So actually, so this map is from last year when we wrote the report. In December, Grants Pass went over 40,000 for the first time. And so in subsequent years, Grants Pass will have a buffer around it indicating that it's urban. So which variables did we end up with? Um, so because we were using zip code as the basis for geography, the data had to be available at the zip code level also. The data had to be updated annually because we write the report every year. The data has to be available to us pretty easily and has to cover primary care, dental care, and mental health care. So we came up with 9 different variables broken down into 3 different categories. The first one is availability. Are needed providers available locally? Affordability, is the community able to afford to see these providers? And utilization, are the people in these areas actually using their physical, mental, and oral health care? So 4 of the variables are availability, 1 is affordability, and 4 are utilization. So the first variable under availability is travel time to the nearest patient-centered primary care home, or PCPCH. PCPCHs are clinics that have passed the minimum set of 11 criteria set by OHA. And the most important of these are screening and referral for mental health and substance abuse, 24/7 access to live clinical advice by telephone, and ongoing management of chronic disease. So this is the first map, and this is what the result of that variable looks like. These are the dots are towns and cities where PCPCHs are. And for the state as a whole, the average travel time to the nearest PCPCH is 12.6 minutes. On this map and then all subsequent maps, any area that is shaded is worse than the state as a whole. So The shaded areas here are going to be longer, have a longer drive time than 12.6 minutes. North Lake, for example, is 67 minutes, and Jordan Valley is 75 minutes. So the second variable is under availability is primary care capacity or percent of primary care visits able to be met. So this is basically a pretty complicated version of just a provider to population ratio. So not only do we take the number of providers, but we actually get their PE that they specifically only see patients and get that for their primary and secondary locations, and then multiply that by the estimated number of visits each subspecialty is should be able to see based on data from HRSA. Every year, HRSA collects patient encounter data from all the FQHCs in the country. And so that's the numerator, estimated number of visits provided for all these primary care specialties. And then that is divided by the estimated number of visits needed by the local population based on their gender and age breakdowns. So then the CDC, every 2 years or so, does a survey asking people how many times they want to see a primary care provider. And then they break that down into different age and genders. And so a person who is older or, child, women usually go to see primary care providers more often than other people. So uh, so basically this is going to be estimated number of visits provided divided by estimated number of visits needed. And ideally that the final equation would be 1 or more, meaning that the number of visits provided needed is equal or there's more actually visits that's able to be provided. So for the state as a whole, that number comes out to 0.98. And all the areas that are shaded are worse than that number. And the areas in blue have no primary care provider FTE at all. So places like Cascade Locks, Powers, East Klamath, Alsea. The third variable, also under availability, is dentists per 1,000 population. We take patient care FTE for all dentists at both their primary and secondary locations, and then divide that by the population times 1,000. So for the state as a whole, there is an average of 0.47 dentists FTE per 1,000. The areas that are shaded are worse than that, and the areas in blue have no dentist FTE at all. So that's Cascade Locks, Maupin, Powers, Port Orford, North Lake, East Klamath. Fourth variable, also under availability, is mental health providers per 1,000 population. We take all psychiatrists, family marriage therapists, psychologists, social workers, psychiatric NPs, and psychiatric PAs, get their patient care FTE in their primary and secondary locations, and divide that by the population times 1,000. And for the state as a whole, it is there are 1.15 mental health provider FTE per 1,000. Most of them are located in urban areas. So basically, everywhere else in the state has a rate that is worse than that. Areas in blue have no mental health provider FTE at all. So that would be Cascade Locks, Warm Springs, Fossil, Powers, East Klamath. Fifth variable, this is the one for affordability, is the percent of population between 138 and 200% of the federal poverty level. So 138% is the cutoff to get Medicaid. And so this measures the number of people between above that, but under 200%, who are still too poor to get health insurance on their own unless they get it through their job. So that's what the map for that looks like. The there are 10.4% of the population that are between 100 and 200%, 138 and 200% of the poverty rate. The areas that are shaded are worse than that, and areas in blue have the highest rate, with fossil at about a quarter of their population, as well as burns. So the sixth variable, this is the first one for underutilization, is inadequate prenatal care per 1,000 births. This is care that did not begin until the third trimester or consisted of fewer than 5 prenatal visits. Inadequate prenatal care more often results in higher rates of low birth weight babies, premature births, stillbirths, neonatal death, and infant death. So for the state as a whole, there are 60.3 per 1,000 births have inadequate prenatal care. And places like Reedsport, Gold Beach, North Lake, East Klamath, Mackenzie Blue River have much higher rates, with Warm Springs at about 30% of their births having inadequate prenatal care. Seventh variable is ambulatory care sensitive conditions, also known as preventable hospitalizations. These are inpatient discharges that should have been preventable had they been treated with timely and effective care. These include conditions such as asthma, diabetes, hypertension, and pneumonia. For the state as a whole, there are 5.8 preventable hospitalizations per 1,000, and Warm Springs has 22.2, Reedsport has 15, Blount Enterprise 11. Eighth variable is emergency department non-traumatic dental visits per 1,000 population. These are both inpatient and outpatient ED visits with a primary diagnosis of dental problems that are not a result of trauma. But because there's no dental facilities in EDs, pretty much most of these visits just result in opioid or antibiotic prescriptions, and they would have to get dental care at some point anyway. So for the state as a whole, there are 3 non-traumatic dental visits to ED per 1,000, and Warm Springs has 17.7. And then the last variable is emergency department mental health and substance abuse visits per 1,000 population. These are both inpatient and outpatient ED visits with a primary diagnosis of mood disorders, anxiety, alcohol, drug use, schizophrenia, and other psychoses, suicide attempts, and suicidal ideations. In the Mental Health America 2023 ranking, Oregon has the highest prevalence of adult and youth mental illness and substance use issues of all 50 states and Washington, D.C. For the state as a whole, there are 16.3 emergency department mental health and substance abuse visits per 1,000 population. All the areas that are shaded are higher than that rate, with Warm Springs having 74.5. So how do we get the final unmet need score? We gave each variable a score of 0 to 10, depending on variances from the mean of that variable. And then we add those scores together so that they can get either the maximum of 90 and the minimum of 0. The result is that all but 2 of the areas that fall under the mean of the final unmet need score are either rural or frontier. That's what this map for unmet healthcare need final score looks like. This color breakdown is by quartiles. So the darkest red areas have the lowest, worst numbers, and then the dark gray areas have the highest and best numbers. So the bottom of the ranking are North Lake, East Klamath, Crane, Yoncalla, Port Orford, Warm Springs. And if you want to look at those numbers further, we actually have a Excel spreadsheet that you can download that has all the results for all the variables, and you can basically alphabetize or look at this however you like. there's also a table version of this in the report itself, which has a lot more detail. There's footnotes for basically for everything. And that's the end of part one. Um, you can email me about it at onge@ohsu.edu. That's my last name and first initial. Okay, part two. We have 6-page primary care service area profiles for all 128 service areas in the state, and I'm just gonna go through one. This one is for John Day. So first page has the zip codes that are in that service area. Then demographics from Claritas by past and future numbers compared to rural, urban, and Oregon, and then population breakdown compared to the rest of the state, and then further population breakdowns compared to the rest of the state, race and ethnicity percentages, socioeconomics from the American Community Survey, uh, a lot of social health data here compared to the county, rural, and Oregon, total OHP eligibles, more socioeconomics. These are only available at the county level, but there's free reduced lunch, per capita income, median household income. And then there is maternity outcomes by race and ethnicity compared to the state as a whole. Then there are cause-specific death rates compared to the county, rural, and the state as a whole. And this is ranked according to highest to lowest for the state. Number of deaths on average per year for the 5 years that we look at. Mortality figures, preventable hospitalizations, behavioral risk factors, a lot of chronic disease data here, unmet healthcare need results, and then the number of patient care FTE for all these practitioners that we get from OHA, broken down to primary, dental, mental, and other, and then supply and demand calculations for the service area, the types of clinics in the area, and then basic hospital data if there's a hospital in the service area. Then designations of shortage by that service area. And that's part two. Okay, here's part three. So this is our website. And so first of all, if you scroll down a bit on the website, there's this part here under newsfeed called data updates. And this is pretty much where we put every update and or new piece of data that we have on the website. So this should be one of the first places you look to see if there's anything new. So most of the data elements on our website is pretty much just under here. First tab, data publications and maps. So when you click on that, just the first tab, it'll give you different definitions of rural and frontier, with the first one being our definition, which is 10 or more miles from a population of 40,000 or more. The Census Bureau definition, the MSA definition, and each one of these comes with a map that you can click on. RUCA, and then frontier and remote area codes. And this link down here, this Am I Rural tool, is actually super helpful. If you click on that and you type in your specific address, it will tell you the different definitions that would determine whether you're rural or urban, and whether you can get eligible for grants or RHC status. So then the second one here is a page about primary care service areas. I already went through that in the report, but you can download a list of all the zip codes and their associated service area, the race and ethnic percentages for each service area, and a sample profile, and a list of data sources for the profile. And you can just contact me anytime for a profile for your community. Then this is healthcare need designations. So this is where you can find the areas of unmet healthcare need report. And then there's a Tableau visualization of all 9 variables, which I'll go through later. This is the spreadsheet that I showed you earlier that you can download, the governor shortage area, HIPSAs, and all the maps associated with it, MUPs, and then there's maps for that also. Maps. Okay, so this is where all the maps on our website are. These are the maps for the areas of unmet healthcare need. There's a static map for each of the 9 variables plus the final unmet need variable. Demographics, socioeconomics, health status data. All these are in PNGs, so you can easily put them in your presentations or reports. The different designations, facility, maps, hospital, RHC, Indian tribal clinics, all sorts of stuff, maps by congressional district, ORH activities, frontier and rural, definitions, Tableau visualizations, telehealth information, and workforce data. So I'm just going to go over the Tableau public page. I downloaded. So when you click on this Tableau public link, it'll bring you over to our Tableau public site. And there's 6 maps here. How many of you have like gone to an interactive map or visualization online and then been just like, there's so many options to click on, and the thing just like zooms in and out without your consent, and it's just like pretty frustrating. I purposely made these to be as simple as possible. So I'm just going to go through each one of these pretty quickly. So this one is CDC places health data by ZICTA. So this is down. ZICTA is ZCTAs are the census equivalent of zip codes. So this is behavioral risk factor surveillance system data down to pretty much a zip code level. And all you have to do is choose the value that you want from this top drop down. And yeah, there's tons of stuff here. And so I split this out into 2 tabs because so that people aren't confused. This tab are where a high value means it's worse, and then this tab means a low value means it's worse. But yeah, you can just click on any of these ones. This particular one is all teeth lost among adults aged 65 years and over. And then all you have to do is just hover over each area. You don't have to click on anything else. And it'll give you more information on that particular ZICTA. And then there's a table here too. And then when you click on here, this will send you to the actual CDC Places website, where you can look at a lot more data and download CDC Places information. This one here is causes of death. by service area, and same thing is just choose the cause of death that you want to look at. Um, and yeah, so it's pretty quick. And then you just hover over the service area that you want to look at, and it'll pop up a table within that pop-up that ranks the causes of death in descending order specifically for that service area, along with the average deaths per year for the past 5 years. So the reason why I do that is because, in case the rate for a place, the cause of death rate for a place is really alarming, the place might just have like a really small population. And so maybe only like a few extra deaths, in 1 year will skew their numbers. So it's always good to have to know the actual n variable, the actual number of deaths, so you can see like how many people this actually affects. Um, Next one is rural health clinics in Oregon. So on this one, you can zoom in and out. So if like there's multiple clinics in near an area, and then just hover over the RHC, it gives you the address and then a link. There's a link to every clinic, and then when you click on that, it'll just take you to their that clinic's specific homepage. So you have to click on anything on this map. This one is primary care docs per 1,000 by service area. So this is 5 years worth of primary care licensure data for for the state of Oregon by service area. And the only thing you really need to choose here, if you want, this shows all primary care right now, but you can go up here and you can choose a specific um, specialty of primary care, and then that'll show up on the map. Um, Tricky. Okay, so then you just hover over each service area, and it'll bring a line graph showing the number of primary care active primary care docs in that service area for the past 5 years, as well as a breakdown of the specialty for the latest year. And it's pretty, this over here is pretty much the same data as the, yeah, it should be the same data as on the right. This one is, oh yeah, so this one is the areas of unmet healthcare need um, visualization. Each of the variables is up here as a tab. So all 9 variables are up here that you can choose from. This one is just the final unmet need score. So when you hover over a service area, it gives you their score for the past 5 years compared to the state as a whole. And that's the same thing for the other variables. I'm going to click on this one. This one is inadequate prenatal care per 1,000 births. And the line graph will show you their results for the past 5 years compared to the state. And so that's true with all the other tabs on this map. And so let's go back here.
Emerson, can I interrupt you for just a second? There's a question that came in that was relevant to the provider maps, and someone is asking if you can access data for a specialty not already in the drop-down map.
I can. We just purchased that from the OMB, Oregon Medical Board. But yeah, if there's a specific one you're looking at, I can send that information.
So they would email you to
Yes.
request that? Okay, great, thanks.
Um, okay, so then the last thing here on the data section is data and publications. And this is where another link for the profiles. And then this part here is actually, I think, a really great resource. These are websites that I have personally vetted as having useful and well laid out information. A lot of them are at the county level, but if you're okay with that, these are really there's tons of data at the county level. But there's other ones that are not. There's obviously the CDC places link is here. There's yeah, social determinants here from AHRQ, but a lot of death and birth data. And then there are pages that um, help you write your community health needs assessment. And there's there's like hospital data in here also. So yeah, check this out. This is like lots of great data here under the other Oregon health data resources dropdown. Then there's our own publications that we come out with over the years. And I think that's it. Stop, stop sharing here.
Thank you so much. Really great information and lots of kudos and people impressed in the chat, Emerson, if you scroll through there.
Oh,
So I'll start us off with one question and then invite folks to please put your questions in the chat or again, raise your hand and we can unmute you to ask that question live. Ooh, I just saw claps and party horns and all sorts of stuff happening for you, Emerson.
no, which
Um,
I'm sorry, I forgot to say that um I really welcome, like, especially on the Tableau site, if you go through that or look at even just static maps, and there's any suggestions you have to either make um the maps easier to understand or just like another map that maybe you think would be like really helpful for other people that I could put together, or yeah, any kind of suggestions or anything, let me know.
I do want to capture one suggestion that came in from somebody who would like to see the tribal communities kind of overlaid on top of the other communities, if that's a possibility at all. We have Warm Springs represented, but then, you know, the other tribal areas.
Um, yeah, I think I would have to. The thing with that is that Warm Springs is the most obvious one because it has its own zip code, and so I'm not sure whether the other communities are also just under one zip code or how what shape they are or where they are in that zip code, and yeah, it would just depend on whether on like how homogeneous, if it's similar to Warm Springs, that their area, I could map out.
Yeah, something to think about and look into for sure. Somebody also asked if you're available for presentation on a specific topic or data for a group.
Yeah, sure.
I put Emerson's email address in the chat a few times, and invite you to please reach out to him with those requests as well. One thing that I wanted to ask Emerson, if you could go back to the MI Rural tool. I think sometimes it's a little bit difficult, you know, as a place to start looking at understanding your community or region's own reality or your zip code's reality. Um, if you could put in an address and kind of walk us through the meaning of some of the categories that they outline. For example, they outline, you know, whether the area is eligible for FORP grants, which are grants from the Federal Office of Rural Health Policy, whether that area is eligible for a rural health clinic. And then there's some other categories. But if you could run that report and walk through that, because I think sometimes I even struggle myself in understanding what those pieces mean in reference to my own rurality.
Yeah, so this is the link that you can go to. I think if you even if you just type like "Am I rural?" or uh it might pop up. But so you can type in a specific address here. I don't really have a specific address in mind, but you can just go like just type in the city even city Baker City, and then yeah, so it'll pop up here on the map. You just press run report, and yeah, it just gives you a report on Baker City. Then there are all these definitions and whether they're eligible for these rural definitions. Then program eligibility for the Federal Office of Rural Health Policy, RHC program, and then all their. This is actually, I think, one of the most helpful parts is they tell you whether you're eligible for these shortage designations and the dates, and so a lot more detail. And yeah, shortage designations, program eligibility, rural definitions.
And so if a community, for example, is sort of on the cusp of being rural and those areas that you just pointed out, the shortage areas, how is that to be interpreted by organization that may not be eligible for Federal Office of Rural Health Policy grants, but they're eligible for a rural health clinic, and then they have shortage designations? How do you interpret that?
I mean, um, they just use different definitions. So like RHC uses urbanized areas from the census, and then FRHP uses RUCAs. And so RUCAs take up more, the urban areas take up more space under RUCAs. So you could be eligible for RHC but not eligible for FRHP. It's just the fact that they're just using different definitions. So you could be eligible for one or the other, but not necessarily both.
Great, thank you. And I'm not seeing any other questions in the chat right now, but I'll give folks just another minute here. And while we're waiting, Sarah, if you could put up the final slide.
Okay, got it. Hang on.
Okay, and I'm seeing no additional questions or hands raised. So we'll go ahead and close things out. Really want to thank you, Emerson, for presenting this. You've worked on so many different tools for our state to understand the rural landscape as it relates to healthcare in particular. So thank you for that, and thank you for making these resources available. A few announcements for everybody before we close out. Our next community conversations is on May 23rd at noon. And we're going to talk about tackling workforce challenges through recruitment and retention. You can, if you go to our website and look on the events dropdown, you'll be able to find the registration link for that. Also, our Rural Population Health Incubator grants are due on May 3rd. As a reminder, these are, excuse me, grants in the amount of $10,000 each that we're providing to rural health clinics, critical access hospitals, and rural community-based organizations to address a population health challenge in your community. The link is on the slide, which will be sent out later. We have our first annual Forum on Rural Population Health and Health Equity, which will be virtual, June 12th through the 13th, and registration is now open for that. And then finally, we have our 41st Annual Oregon Rural Health Conference, October 2nd through the 4th in Bend. Registration isn't quite open yet, but we do have our agenda on our website if you want to take a look at that. And we'll definitely make sure that everybody receives the announcement about when registration is open. So with that, I'll close us out. Thank you everyone for participating today and for being here with us. I hope it was a useful and informative session for you. And please feel free to reach out anytime with your questions, suggestions, and ideas. We're happy to help. Thank you.
Thank you.